Good afternoon, everyone, and thank you for joining the session on Special Focus, Adolescents and Emerging Adults. My name is Hala Najm, and I will be presenting our panelists for the session, our very special panelists for the session. I will start with Dr. Carmen Orte. Dr. Carmen Orte has holds a BS in psychology and a PhD in educational sciences at the University of the Balearic Islands. She's the director of the official university master's degree in socio-educational intervention in childhood, adolescence, and family. She's also the director of the master's degree in addiction, which is the EOPC-UTC, the principal investigator of the Educational and Social Research and Training Group, director of the Family Research Lab, research leader of the Evidence-Based Family Competence Program since 2004. Her research fields include effective sexual education, family prevention of drugs and behavior problems, and training of university youth leaders in drug prevention. Her main competitive research projects of the last 20 years are grouped around the Family Competence Program, a pioneering research in Spain based on scientific evidence for family drug prevention. She has also participated in the European project, the UPC ADAPT, for the standardization of a European drug prevention curriculum for professionals in the European Union. Dr. Carmen Orte, thank you for joining us. And
thank you so much, Hannah. It was a while. I am so happy to see you again. Well, I want to thank the organization because this huge event is very difficult for us, joining more than 1,000 people, and also the ICU, DDR for having me. I am going there to have my presentation. Yeah, thank you. Well, Hala was talking about our work, my work, the work of my team about family prevention. We are running a big program in the Balearic Island and in different parts of Spain related with family prevention. So we decided to start a new program for young people, for the people who is studying at the university, because we thought it was a good idea to spread prevention and to raise young leaders from the university, connected with that big program, evidence-based about family. So the question is not only if can people be young people be active agents on prevention. For me, the main question is how we can do that at the university. How can we train that students at the university? So we started with, there is some literature related with the good things that comes from the investing in young people. So for example, the Agenda 2030 from Europe, or the work done by United Nations, are good work related with the good things that happen when you work with young people. And also other actors that talk about the good results you get when you work with young people. Not only because they will be trainers of other equals, for example, other people the same age or even under their age, but also for them to learn new things. They like as trainers, as young people. So the idea under this research, we have this is our 5th year. We are working with these young people at the university. The main idea was to give them skills, resources and competences, increase their actions between them and between other people, other young people, give them real social contribution and strengthen their participation in their own environment. So we have published many things, many published work, books and articles related with this and with the work we have done, because we are using a quasi-experimental design. We evaluate them previously to intervention. We evaluate them at the end, 3 months in between them, and also we compare with another group, in this case from pedagogy. So this was our first chapter related with our project called The Implication of Young People as Active Agents in Prevention, a project about youth positive development. And also we have published other books. Our last book is the last one, is That one on the right is training in leadership for young people in prevention. It was out last May, at the end of this May, and every book is related with how to work with young people to train them to be young leaders in prevention. This is the main idea, this is the main project. This project, as I told at the beginning, is connected with the family prevention program. So we don't train them abstractly, we train them in an evidence-based program. So we went, at the beginning, we started with a protocol, we validate a protocol into size, face-to-face training. We have students that are here, like you, and other students that are doing the social education training at home, at house, by online. Anyway, this training protocol, it was designed to social education studies, is a social education degree. They are in their third year, and it's a specific training designed for them, with this program, this family program, intended for families with children between 12 and 16 years old. Our main objective was to provide skill and strategies to these students to empower them and promote the acquisition of an active role in prevention. And the whole program lasts 25 hours, 7 sections, 3 theoretical sessions and 4 simulating sessions. You will see, they are my students from February 2024, the last student, the last group. So the first part is, the first phase is theoretical. We train them with 3 sessions lasting 6 hours. We train them in the program, in the family prevention program. Then during this time they learn about the program, everything from the objectives, the family profiles and the evaluation of this program. In the second phase they learn how to, we simulate different sessions. We simulate adolescent sessions, we simulate parent sessions, parent training sessions and the family training session as a whole. So they learn how to do it, how to implement the program. In fact, this is one of the sessions of the other group of my students from last semester. And here they are doing a simulation of an adolescent session. And here we have the 2 trainers. They are trainers, the same students. We have the adolescent. They are simulating the adolescent, and the other group that is surrounding are other students that are doing feedback, giving feedback. So they receive 3 types of feedback. Our feedback, my feedback, and another colleague that is with me. The auto feedback they do by themselves, how they are doing the session, and also the feedback by other people that is watching. I don't know if how I can put it to see, maybe? Just to see the video. Just to see the video. This is a video. This is a video. Yeah. It's in Spanish, but I want you to see them, how they do. You see? They are preparing the papers, they are preparing everything, but everyone is a student from the same group. We have 2 groups, this is one of the groups, and they're preparing, and somebody is telling the other what is happening in the session. So, but we are like this, all from October to February, we are training these students. We can finish, we don't need more. Well, one thing we have evaluated many things before and after the implementation of the program, many. But I have selected some of the most important, for example, the intrapersonal variables. Why? Because these variables are very, very related with the positive youth development. They are very, very related, very close to their needs to be good trainers. Then we have evaluated emotional stability, self-confidence and resistance to adversity. And you know what happens? We found differences between the people who were consumers at the beginning and also when we finished the program, because they were normal consumers of alcohol and tobacco, but not everyone was consumer. So we saw differences in these 3 variables between them. But the good news about this, well, the sample was, in this case, was 66 degree study students main age 21.8. But we use this instrument, and also we evaluate the frequency and the use of drugs, because we wanted not only give them skills, but also we wanted to know what happens when you give them skills. It happens something new, like for example, they have the same situation in these variables, in these good variables that are good variables to be good trainers. What happens? Well, in the case of the tobacco users, this is a comparison between the non-users and users. We saw the differences. The people who is consuming tobacco or alcohol, the same students, the same degree, the same third course, are different. So they are lower in these variables. So they have lower emotional stability, they have lower self-confidence, they have lower resistance to adversity. This is the case of the people that do the consumption of tobacco, and also that people that do consumption of alcohol. What happens when they do the training? What happens? What is related with the people who was consuming at the beginning? So they improve these variables. This is the good thing for us, because if we are training everybody in the same way, you think, we are going to train all these people, but they are not the same. They are studying the same, they are more or less the same age, they are going to be in the field at the same moment, but they are not the same, because some of them do consume, others not. So what happens is that the interpersonal variables that I was telling you were different at the pre-test and also at the post-test, when we did the training. So these interpersonal variables for us are gold standards, are very important to train when you train the trainers, in this case the young people, are different at the beginning and when they finish, and they improve the scores at the end. And this is, we think, because it's because of the training. So they learn many things during the training, related with the content of the program, related with the leadership, but also they improve their situation. I don't know if I am explaining very well, but they improve their own situation, so they can be better leaders if they improve these variables. Well, we are very proud of this program. It has received two prizes last year, 2 prizes because we evaluate them with 2 systems. We evaluate by questionnaire, but we evaluate also by camera. We record their audio, we record on TV, and then we compare the results between these 2 systems. Well, we are very positive with this program because it's a way to work in prevention, in leadership with young people at the university. Thank you so much.
Dr. Carmen, thank you so much for a very interesting presentation, and thank you for the work that you're doing with our youth. Our next presentation will be about the effects of an instructor-led Healthy Minds intervention for prevention of mental health and substance use problems among adolescents, a pilot testing in Pakistan, by Dr. Salman Shazad. Professor Shazad is a consultant clinical psychologist working as a professor of clinical psychology at the Institute of Clinical Psychology in the University of Karachi in Pakistan. He is currently leading the research and training unit for prevention and treatment of substance use disorders at the Institute of Clinical Psychology. He completed his specialization in substance use prevention and treatment, education, and policy as a Fulbright Humphrey Fellow at the Virginia Commonwealth University in the United States of America during 2016 and 17. He is one of the global master trainers and prevention coordinators for prevention and treatment and substance use, which are the UPC and UTC. Dr. Shazad is professionally associated with numerous international organizations and associations in the field of mental health and substance use, prevention and treatment. He has developed indigenous manualized prevention and treatment interventions and programs on mental health, and substance use prevention and treatment, and he has also been part of the development and adaptation for these interventions in his local context in Pakistan. Dr. Shazad, the floor is yours.
Thank you so much, Hala. Before I start my presentation, I should not forget to acknowledge the ISOP International, as well as the ICUDDR and INO, for giving us an opportunity to meet and to greet and to learn from the global leadership, especially in the field of substance abuse prevention, treatment, recovery, as well as the policies. There's one of the presentation which I'm going to deliver is related to the one of the indigenous the prevention intervention that we have designed back in Pakistan. So the project was given by the USEFP, United States Education Foundation for Pakistan. It's a part of my Humphrey Impact Award, which they give every fellows when they return back from United States to their home countries. This was also supported by the Institute of International Education and the U.S. State Department. And I should not forget to acknowledge the Education Services for Pakistan, because we have collaborated with them to implement and also to incorporate this intervention in their school curriculum as a part of the SEL, social and emotional learning. My colleagues are the Nasreen Begum, as well as this Saifuddin. I don't know if how many of you are familiar with the context of Pakistan. In the Southeast Asian countries, we are one of the populous country in the globe, 235.8 million population, and out of the total population, our youth is almost 68% of the total population is youth. The data which I am going to present is an outdated 2013, the National Drug Survey was conducted in Pakistan, but unfortunately until now we are unable to publish the data. We have recently in 2022 conducted the National Drug Survey, HRDU, high-risk drug user, but it's not published yet. According to 2013, and the national survey conducted by UNODC, the 6.7 million people used the drugs. Out of 6.7 million, 5.2 million were men and 1.5 million were women. Now, out of 6.7 million, 4.25 million people need the treatment. But unfortunately in Pakistan, at that time, only there was the capacity for 2,900 people, almost 3,000 people, there was the national capacity for the treatment for substance use disorder. And the rest of the people who need the treatment services are out of the treatment services, and they are searching for the treatment services. Unfortunately, in National Drug Survey, there was not any, that didn't include the adolescents population, only the 15 to 64 years old. But unfortunately in Pakistan, they have the prevalence of substance use among children. And one of the case which I have seen is the 4 years old baby girl from the Karachi, is one of the populous city in Pakistan, was the 4 years old baby girl who used opium. So in addition to this, there are the many children, baby girls and boys who are using cannabis and the inhalants and other drugs. Unfortunately, the alcohol and heroin are also used by the kids. Again, this is not the case of the substance use disorder, but also the mental health problems are the growing health concern for Pakistan, especially for the health professional, the clinicians, and the researcher, and the public health specialist. The study conducted in 2013 in Karachi we found that almost 20% of the adolescents who were going to school reported to have the severe level of emotional and behavioral problems such as the anxiety, aggression, social withdrawal, and rejection, somatic problem, depression, as well as the academic problem they were facing. One of the study in the northern part of Pakistan, we conducted a study, small study. Again, there's a problem related to the alcohol use because we are living in the Islamic Republic of Pakistan. People say, how is it possible that you are in a Muslim country and you use alcohol? Because in Islam it is haram and forbidden. It is not true. People who are Muslim are also using the drugs and alcohol. Unfortunately, those who were using the alcohol, the prevalence of the mental health issue, the aggression was quite high. One of the study we published in John Valley's with one of my mentors when we cleared at the VCU, we found that the adolescents population in the northern part of Pakistan, because the cultural acceptability towards drugs and especially alcohol is quite high, people don't consider the alcohol as an illicit drug. The parents advise kids not to use the cigarettes, the vaping or heroin or other drugs, but again it's acceptable in order to fight with the harsh weather, especially in winter season. If you go to the part of the northern part of Pakistan, the temperature falls almost for minus 31 degrees centigrade. So home-brewed alcohol is available, and we are very close to the Chinese border, so people import the alcohol beverages, and this is the problem. So again, those adolescents who were using the alcohol, they had the internalizing and externalizing problem, as well as the attention problem was quite high in the adolescents population. And not only in the adolescents population, and recently one of the projects that I had, the World Bank project in the university population, higher education institution across the country, it was given by the Higher Education Commission and the World Bank groups. So the 43% of the university students are using the smokeless tobacco as well as the other drugs, unfortunately. The 2% of the university population are also using the crystal methamphetamine, unfortunately. So you can see the association of the substance use with the well-being as well as the aggression and other mental health issues are quite high, those who are using the illicit drugs. The problem that we are facing in Pakistan is unfortunately both at the system level as well as at the service level. The policies, we have the good policies, but unfortunately we don't implement those policies. The lack of the political will is another problem. Allocation of the resources for the prevention of substance use as well as the mental health problems are quite high. And unfortunately the substandard treatment intervention and the prevention intervention, the name of the prevention intervention just only the lecturing to the students, and then we consider it as an evidence-based prevention. Due to the lack of the scientific research and dearth of the evidence-based prevention intervention, the crime rates among the adolescents and the young adults is quite high. Violence, self-harm, again the mental health issues are quite high in Pakistan. So again, there is a research evidence that the building intellectual, social and emotional competence in youth is one of the effective strategy and in order to improve their health and well-being and quality of life. Here is the research evidence. And we in Pakistan, unfortunately, we are quite lag behind to meet the Sustainable Developmental Goals. And again, the Sustainable Developmental Goal 3 and 3.5. Now we are thinking about what can we do to meet these standard Sustainable Developmental Goals. So we thought that why shouldn't we focus on the intervention for the population, the 68% of the population. Unfortunately, in Pakistan, we don't have any evidence-based prevention intervention. There are many evidence-based prevention interventions out there globally in the region, but again, these are very expensive, and we cannot access to those interventions. So we developed one of the intervention which is called as the Healthy Minds to build a resilient building resilience through a healthy mind. This is based on the positive youth development the program. This is grounded on that. The study we included the male and the female population in some part of the country, and between the age of 12 to 17 years, and both gender, male and female. And it was piloted, the study, the intervention was initially piloted in the non-governmental organizations. And this is the part of the country, is the northern part of Pakistan, which is the nearby Tajikistan, Wakhan, Afghanistan, and the Chinese border is the Gilgit-Baltistan, and the other part is the Chitral, nearby the Wakhan border, and the Russia, as well as the Tajikistan and the Afghanistan, in some borders. It's very famous, especially Chitral, is the Shandur Mela festival, which is for the wild polo. It's very famous. These are the four sites, two sites we selected for the intervention. The instrument we use, the socio-demographic information, now the brief sensation seeking scales, as well as the CER2 short version we use, and an AQ12, and these are the tools which have been translated and adopted into Urdu language, because it's the national language in Pakistan. And the involvement, we use the certain criteria. This is the total sample width for the pilot study was 849. Out of them, the half were the intervention group, and another was the control and the waitlisted group. The findings you can see here, these are the sensation seeking, emotional regulation, aggression, and all the variables that we selected were significantly this would be related with those who attended the healthy mind intervention as significantly improved in their social and emotional domains. So the findings briefly I should discuss, and these are the significant effect of the intervention of the healthy minds on the sensation seeking after controlling the pre-test scores of the sensation seeking, as well as the other variable after controlling the pre-test scores of the variable that we had selected for the intervention. And also the significant decline after the 14 weeks program, after implementing this 14-week program, significant decline in the aggressive behavior and all these variables that we already selected. But again, we cannot claim that this is one of the evidence-based intervention. This was the pilot study, and we need a lot of refinements and improvements in this intervention to make it more generalized and to implement and expand across the country in Pakistan. So because we had the small samples, and we also we need to aid especially the other provinces. We also only recruited two provinces, but we have the 5 provinces, and the rest of the 3 provinces we had to consider, and we need to add the sample. And again, we in the initial phase, because we got permission from the non-governmental private sector schools, but we need to add the public sector school because they are more vulnerable as compared to the private sector schools. And a refinement with the larger sample and implementation trial is very important. So we can see that adolescence is one of the crucial and critical phase of life, and we expect that we cannot say the adolescents will not face the stressors and all these things. We expect they will face the stressor, but it's our responsibility to help them to build the resilience to cope up with the difficult situation and the circumstances in their lives. So these were some of the glimpses of the program. We